Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, so today we will start with a new topic, that is Ayurveda understanding of basic concepts and management of apasmara and other childhood epilepsy syndromes in Ayurveda. The topic means that how to understand the basic concepts and management of apasmara in Ayurveda in relation to different types of childhood epilepsy syndromes. So we find many types of childhood epilepsy syndromes, and how exactly we can understand these childhood epilepsy syndrome in relation to Ayurveda. Whatever we consider in Ayurveda, it may be apasmara, it may be unmada, apatantrika, apatanaka, whatever. And these different types of childhood epilepsy syndromes, how it has to be understood in apasmara. So that we will going to discuss in this series of classes. So let us start with some of the basics. It may take some time, but it is better to understand the basics so that the things will be very clear. Now, in the common medical practice, usually we come across with different types of words, isn't it? For example, we use the word seizure. Many times we use the word convulsion. And many times we use the word epilepsy. Then there is a tremor, chorea, athetosis, paroxysmal event. So these are some of the common words which are used whenever we discuss about the convulsive disorders or epilepsy syndromes, etc. Now, what is the basic difference between these words? What do you mean by seizure? No doubt, seizure is a sudden, jerky, rhythmic movement or arrhythmic movement, or hazards, or atypical, movements, or spontaneous. So, sudden, jerky, arrhythmic, and atypical, and as well as spontaneous movements. So they are called as seizure. Now, to name a particular event as seizure, you have to have three important things. There is sudden, jerky, arrhythmic, or spontaneous movement with the definite involvement of motor activities or abnormality related to the motor activities, abnormality related to the sensory activities, and abnormality related to the autonomic activities. There should be abnormality related to the motor system of the body. There should be also the abnormality related to the sensory system of the body. There should be also abnormality related to the autonomic, sympathetic and parasympathetic system of the body. Along with that, there will be sudden, jerky, arrhythmic, spontaneous movements. This is called as seizure. Seizure is that condition where there is an abnormal electrical discharge leading to sudden, jerky, atypical, spontaneous, haphazard movement of the body involving the abnormality of the motor system, sensory system, and autonomic nervous system, and that event is called as seizure. So three things should be there. Patient should also show the abnormal motor activities. So that is usually seen in the form of the abnormal body movements and all those things. He should also have the sensory involvement. He should also have abnormality, the sensation. Suddenly he feels something. Suddenly he can feel the sensation of itching or some other hallucinations or whatever. Some sensory changes which is not existing actually, such a sensory changes he is having. And there will be abnormality of the autonomic nervous system. Patient is having excess sweating, patient is having passing of the urine, there will be excess secretion of the glands like salivation and all those. These are all indicative patient is passing. Involuntarily patient is passing the stool, involuntarily patient is passing the urine. So these are abnormal autonomic activities. So when all these activities are present, presentations are present, then only it is called as a seizure. Okay, so motor involvement is there, sensory involvement is there, autonomic nerve involvement is there, which is spontaneous. Okay, haphazard, atypical, arrhythmic, then sudden and jerky. Now, if this is a seizure, then what do you mean by convulsion? Isn't it? Sometimes we also use the word convulsion. So, what do you mean by convulsion? So, convulsion actually is also a term used for seizure. Okay, but when only the motor part is more dominant, then the word convulsion is used conventionally. That means in a seizure, we expect there is involvement of motor system, sensory system, and autonomic nervous system. Okay, the only motor system involvement or symptoms of motor involvement in a seizure, like the abnormal movement of the limbs, body muscles, trunks, etc., or deviation of the face. So these are actually the abnormal motor symptoms because of the muscle involvement it is happening. That is sometimes called as convulsion. That means predominantly the motor involvement of a seizure is named as convulsion. Otherwise, there is no much difference between seizure and convulsion. Seizure means there should be all the three involvement, but only when the motor involvement is there, or because motor involvement is there means usually there will be also sensory involvement. Usually there is also autonomic nervous system involvement, but it is not understood sometime, not manifest sometime, because sensory has to be told by the patient itself, isn't it? So we cannot, as a doctor, we cannot see, and sometimes patient may not have the autonomic nervous system presentation. So only motor system presentation will be very dominant. In such conditions, we use the word convulsion. Otherwise, there is no difference. Okay. Now, what is epilepsy? Epilepsy means it's nothing but seizure. There is sudden, jerky, spontaneous, atypical, arrhythmic movements involving the abnormality of the motor system, sensory system, and as well as autonomic nervous system is called a seizure. And same seizure when it occurs repeatedly, many times in a day, or once in every 7th day, once in every 15th day, once in every 30th day, it is coming on repeated fashion. Okay, that is called as epilepsy. A single attack is called as seizure. But same seizure when it is coming repeatedly, so then it is called as epilepsy. So seizure, convulsion, epilepsy. So this particular differentiation has to be clear actually. Okay, actually they are all one and same. In the seizure, there should be involvement of these three: motor, sensory, and autonomic. Okay, in the convulsion also there will be all the three is expected, but when only one is dominant, we will usually call as convulsion. Epilepsy means same seizure, but it is coming repeatedly. Okay, so these repeatedly coming seizures are one of the important criteria to say the epilepsy. Okay, now why it is repeatedly coming? Sometimes cause is known and sometimes cause is unknown. For example, grand mal epilepsy or idiopathic epilepsy, what we say, same seizures are coming repeatedly, maybe once in 15 days, once in or irregular time period, but it is coming repeatedly, but cause is not known. So then we will call it as idiopathic epilepsy or grand mal epilepsy. Okay, sometimes it is coming repeatedly, but the cause is known. Okay, so we have got seizure like activity which is coming repeatedly, but cause is known. Then we will call it as epilepsy syndromes. We have got different types of epilepsy syndromes. Okay, so in the epilepsy we have got two. One is cause is not known, another one is cause is not known. When the cause is known, such epilepsies are called as epilepsy syndrome. Lennox-Gastaut syndrome, okay, Ohtahara syndrome, many type of syndromes are there that we will discuss later. Another category is cause is not known, but still it is coming. So that is usually considered under the grand mal epilepsy. Another important thing to differentiate epilepsy is grand mal epilepsy and epilepsy syndrome is, whenever we talk about grand mal epilepsy, that will follow a order. There will be some pre-ictal symptoms, followed by the ictal phase, and then that will be followed by the post-ictal phase. So this particular phase-wise presentation will be seen in case of grand mal epilepsy. Okay, so we have got pre-ictal phase, patient feels something very odd, then suddenly there is a tonic convulsion. This will be followed by tonic-clonic convulsion, tonic-clonic convulsion followed by a sudden opening of the larynx, and there is a loud sound, and afterwards there is a loss of consciousness. Patient falls with a loud cry, then there is a loss of consciousness, then patient again regains the consciousness, then there will be a post-ictal symptoms like headache and all. So this particular pattern is followed when we talk about generalized epilepsy or grand mal epilepsy. In other epilepsies, this particular pattern is not followed, but it is coming repeatedly. It is coming repeatedly. Okay, so therefore it is called as epilepsy. So these are the two things that you have to be very clear. In the epilepsy, we have got a generalized epilepsy and epilepsy syndrome. Generalized epilepsy means it is grand mal epilepsy. Grand mal epilepsy always follow a pattern of presentation. That pattern is because of the way of spreading of the abnormal electrical impulse. That we'll discuss later. Okay, so when the abnormal electrical impulse is spread in the cerebral hemisphere, pass through the reticular formation area, then spread everywhere. So this pattern of symptoms will present. So that follows that particular pattern, because abnormal electrical discharge distributes generally within the brain hemisphere. Okay, in epilepsy syndrome it is not, maybe focal, or it is not widely distributed. Therefore, it is not having that type of a pattern, set pattern of presentation. So this is called as epilepsy. This is called as epilepsy.